they take feedback, that they will actually change it to at least give you guys some sort of either quartile score or score that just for you guys, nothing that we need to see, but so you know what to focus your studies on after step 1 to make you successful for step 2, basically. So yeah, that's one soapbox, but I'll get off of it now.
Thank you for that. And then moving into more so the application in itself, Dr. Peters, when you were writing your personal statement, how did you more so go in about drafting it up?
Yeah, I think it's really just kind of personal reflection about what's most important to you to convey to the selection committee. They're reading, like Dr. Tannan said, they're reading hundreds of these, and so you really you want to make sure that you're putting your best foot forward. And so for me, I think I looked back and I pulled up my old personal statement. First, for me personally, the first paragraph was, kind of why I thought about ophthalmology. My second paragraph was kind of the service that I did related to ophthalmology, or service that was important to me. That was something that I really wanted to convey, that this is something I wanted to continue with my career. My next paragraph was about research, and then my last one was just a conclusion. So that's, again, just one example of how I did my personal statement. I'm sure that there are many different ways to be successful. The advice that I've gotten, and again, Dr. Tannan can correct me if I'm wrong, is just a lot of times personal statements won't necessarily get you the interview, but they can take away the interview from you. So if you have a personal statement that says something bad, or that says that just doesn't come off in a good light, then certainly that can bring you down a peg. So I would say definitely, at least the advice I was given was, don't really take risks. Like, don't try to be cheeky, be honest, be straightforward, really put your best foot forward.
Yeah, I think I definitely agree with all of that. So everyone loves ophthalmology and thinks it's super cool. And so I think you can be a little more selective in what specifically you focus on when you are talking about why you want to do medicine, ophthalmology, et cetera, et cetera. But keep it professional and honest. But don't go over the top, like Dr. Peter said, because if there's issues, for sure, it will be a red flag. And really what we want to see is that you're thoughtful. You can portray or describe yourself, your strengths, and your passions, basically.
And then when, Dr. Peters, when asking for your letter of recommendations from professors, physicians, or whosoever, what went into that decision, and who you decided to pick for your 3 letter writers?
Yeah, for me, I chose 2 ophthalmologists and then 1 neurologist who I thought knew me well. I think the most important thing is pick people that, one, know you well, because a lot of times they will, you are often not reading these letters that they're writing for you. So you want them to be able to say, I worked with Catherine or blah, blah, blah for X amount of weeks, or I know them, or I saw them in the operating room, I saw them in clinic. You want them to be able to say that they know you well. And then 2, people that like you and that can speak highly of you. So especially somebody that you've maybe done a research project with. If you're working with somebody already, then definitely go join them in clinic and make sure that they can see that side of you too. Or if there's a attending that you're really connecting with, ask if you can spend extra time in their clinic or shadow them in surgery or do a research project with them. Like the better that they know you, the better letter that they will write. Now that we're starting, we're reading fellowship applications for the fellows for next year. I'm reading through a lot of letters, and you can really see when a letter writer knows the person well and when they don't. And when they write a really generic one of, I recommend this resident, I recommend this medical student, versus I enthusiastically recommend this medical student. They're in the top 10% of medical students I've worked with, or something like that. All of those are much more powerful. So I would say the most important thing is people that know you well and that can speak highly of you.
Thank you for that. And Dr. Tannan, so oftentimes we hear that when it comes to who you're asking a letter from, it's better that you get it from an academic versus a private practice physician. Do you know why that is? Or if it holds any weight?
Um, I don't know that I agree with that. So I agree with actually what Dr. Peters said, is that what is more important is a really strong letter from someone who knows you well. Again, going back to the intangibles. So we're trying to find someone who's hardworking, who we know can complete tasks, who is a quick learner. And so I would prefer to get that, even if it's from a private practice doctor who said, so-and-so came to my clinic and like came on their vacations and spent their free time and learned how to, look at the retina in a week, or, something like that would mean more to me than, again, a generic letter from the chairman. Like a lot of people think they need a letter from the chairman. And yes, the chairman has a lot of connections. And I think that's where that recommendation comes from, is because academic people have connections with other academic people in the residency world. But I still think you need to have a relationship with them, and they have to see some of your work product, because if they haven't seen work product, they're going to say a generic, this person's great, they're really interested in clinic. And that's good. I mean, you want people who are interested in clinic, but you also want to know what makes this person special. Why do I want this person in my residency program? And the person who's worked with you is the person who's going to say that.
And then in terms of Dr. Peters, you're picking your letter writers. What advice can you give students on how to build an organic relationship with them, as opposed to one that's forced because you quote unquote want a letter from them?
That's a good question. I think just genuinely being interested in them, their practice. I think a lot of, by and large, attendings like working with medical students. If they don't like working with medical students, then don't pick them, don't ask them to write a letter anyway. So I think if you are genuinely interested in that attending's field of research or that attending subspecialty, and you get along with them and their personality, then I think just honestly, I think just be genuine. I think that they'll see through it if you act like you ask them for a letter and then you suddenly start showing up in their clinic a lot more when before you were late or things like that. Like, I think if you just do a good job and you are interested and you build that relationship before asking them, then I don't think that they would, at least I wouldn't think anything bad about that.
And then Dr. Tannan, as a lot of us on this call don't have ophthalmology home programs, it may be hard for some of us to form relationships with ophthalmologists. So would it be okay, or looked at differently, for students who get letters from physicians who aren't ophthalmologists but still do have that connection with them?
Yeah, I think it is. I mean, so I have this situation every year where people will rotate with us where they don't have a home ophthalmology program, and they will ask me for a letter. And I tell them frankly, I mean, yes, this, and this from your rotation, I think are great, but my letter is still not going to be as good as someone from your home program that really knows you well, even if they're not an ophthalmologist. But that's a little more difficult for those of you without home programs. So I think doing aways and getting to know. So this is kind of complicated because you don't know what you're signing up for when you do an away. But if you have an idea of what kind of aways you're doing, and if you are doing an away where you're working with a few specific attendings more closely, that's helpful, because that person will then work with you for a month or an extended period of time and get to know you. And going back to what Dr. Peters said, is you don't have to like call my patients into the room and clean my slit lamp for me to think that you're interested. Like, I think actually just genuinely like reading, looking up things, coming back and saying, oh, like I read this paper, like, what do you think about this treatment? Or like, I wanted to understand this better. Those are the things that I find more useful and more engaging when I'm working with a resident. Than like, it's great that you wiped down my slit lamp, but that's not your job. And I don't need you to do that. You're here to learn, and I want to see that you're learning, basically. So I want to see that you're retaining. I want you to see that you saw something with me in the slit lamp and the next day you saw it yourself, kind of thing. Like, that's what I'm looking for. And that will help me then say in a letter that, well, I might have only worked with this person for 4 weeks, but look what I saw in those 4 weeks. In such a short period of time, I got to see that this person was able to examine the retina, or was able to look at the cornea and pick up on subtle details or things like that. So I really think that's more important. And that's something that gets missed by students, like, because they're trying to help. And I understand completely where that is coming from. They think that they should be doing these like other tasks, but that's not what we're looking for. So, and if you are in a program without a home ophthalmology program, everyone will know that, because we kind of know which schools don't have home ophthalmology programs. So we know that your letters are going to be from people who are not, who might not be from your program. I also think, like, don't feel bad. Like, a lot of discussion now is also that you need 3 ophtho letters. I 100% don't agree with that. I think you can have 1 or 2 good ophtho letters, and then if you have 1 or 2 really good other letters, you'll be just as well served.
So you, Dr. Tannan, you went to my next question about how can students maximize their experience, or what skills would be great for them to have when they're doing their aways. So Dr. Peters, I'll ask you the same question. How many aways did you do, if you did any, and how did you maximize your experience doing those aways?
Yeah, so I did do an away, and I ended up matching at the program that I did my away at. I knew that I was really interested in Duke, especially for the location, as well as just the program itself. And so definitely, obviously, apply to aways that you think you really would be interested in, because this is really how you can shine. Show them how hard of a worker you are, how committed you are, and they can get to know you pretty well in that month. So I would say preparation is definitely key. If you have a home program, then definitely do the home program before you go on your away. If you don't have a home program, then I would say at least try to spend some time shadowing and working with ophthalmologists in the community to try to learn how to use a slit lamp. Try to take a stab at learning how to use the indirect ophthalmoscope or look with a 90 lens. Have those skills, and that you will only look better for it when you actually go on the away. The other advice that I would always give, we have a lot of med students that rotate, with us during my residency, and you could really tell which ones were like the good medical students and which weren't. The ones that came prepared, that like Dr. Tannan said, read up on the night before. So when I did my away, I knew which clinic I was going into the next morning, and so then I would just at least look through the patients, if not, be prepared about what you'll see. You can even think of a question in advance. Like, a lot of, it's important to have good questions when you're a medical student, but you can even think of it in advance. If you read the chart beforehand, you can say, oh, why did this patient get a glaucoma tube and this patient got a trab, or something like that. Just thinking about those questions, you can have those prepared. And then be bold, as in try to really get in there. A lot of med students just end up shadowing, and I know it's really hard to kind of see patients on your own as a medical student, but really the ones that did really blew me away. If they asked to, hey, do you mind if I go in before you and see this patient and then tell you what I see? Boy, I was so impressed with the medical students that did that. So try to do as much as you can. Definitely always say yes. If somebody says that they want you to look at something, or they want you to do something, always say yes. Just show that you're eager to learn. The other advice that I would give is that the application for the aways have an earlier deadline than you may think. So check when those deadlines are, like early in the year, like I'm talking January, because I know some of them are due in February, some of them are due in April, some of them are due later. And my understanding is that most of them have a rolling admission. So if you can submit it as soon as it opens, then I think you'll have the best chance of getting that away. I think that was all my advice. Yeah, just make sure you're prepared before. I think know the basics about the eye, and a lot of, in my experience, they don't ease you in. They expect you to know what they're talking about, and so definitely be prepared.
So we're going to switch gears and talk more about the interview process. And speaking about preparation, Dr. Peters, how did you prepare for interviews?
So there are some questions that you will definitely get. The tell me about yourself. I got at every single interview. Oftentimes, every interviewer would start with that, with tell me about yourself, or a similar question of, if we only had 45 seconds and you had to leave, what do you want me to know about you? So those 2 questions, I would say, definitely have an answer for. Don't be rehearsed. Don't obviously have something memorized, but at least know what you're going to say. So for me personally, for before my residency interviews and before my fellowship interviews, I would literally write out, and I can pull them up and share them with you guys if you want, my answers to questions, to at least kind of know what I want to say. So I had one for, tell me about yourself. What do you want to do with your career? Why did you choose ophthalmology? What would you do if you weren't doing ophthalmology? What are your biggest strengths? No 2 or 3. What are your biggest weaknesses? No 2 or 3. What's your greatest failure? Things like that. Or tell an interesting patient encounter. Those are questions that you can be pretty sure at least one person will ask you at some point during the interview trail. So having a preparation of at least knowing, oh, if I get this question, I can refer back to this patient, or I can at least talk about this, because really you don't want to be put on the spot and be totally unprepared and not answer a question. So definitely, reflect, think about those questions that that you're going to be asked at some point. Of course, you're going to get questions that you didn't prepare for, and that's fine. And, they understand that. And sometimes people are trying to trip you up, but at least know the ones that you should know. And then definitely practice interviewing. Interviewing is hard. It's not easy. So practice interviewing, do mock interviews with attendings. It doesn't need to be an ophthalmologist, and attending in any specialty can help answer questions and give you feedback about about what you're doing. The other thing I would say is you should always be on, the whole day that you're interviewing everybody that you interact with. It was more of a big deal when they were in person, but I would say the same thing in virtual interviews. Think about your posture. Don't be looking at your phone. People notice that, and people will make note of, hey, this person is on their phone. They're not interested in this program. So definitely always be present, always be on. I think that was most of my advice.
And then from a program director point of view, Dr. Tannan, what makes a student stand out to you during interviews?
So I think a lot of things that Dr. Peter said. So, I mean, I have definitely, in the virtual platform makes it so much harder because you can't read body language as much. So I think it's unfortunate, but I definitely have had people where I'm like, are they reading from their screen right now? So it really does need to be like, you need to know what you want to say, but you really should be natural, as natural as possible. Like you're having a conversation with somebody. You guys are all nervous, understandably. But I think we all know you guys are very smart. You're super hardworking and you've done a lot to get here. And we just want to know a little bit about your personality, a little bit about your passions. And if we think that you as a person are going to fit well with the way that our program runs, basically. And that's what we're looking for. So, yeah, and I'll tell you, it's hard to say that we interview like 36 people and I pretty much like all of them. So that's what we're looking for. And we're interviewing really high caliber people. So it's not that hard. I think things that stick out is if you aren't really sure about, your research. So even if you were the 4th author on something, once it's on your application, you better be able to talk about it. And if you talk about it in a very peripheral way, because whether you were super involved in a manuscript or whether you were kind of minimally involved, now it's on your application as something that you completed, which is why you're doing ophthalmology. Then I want to be able to have an educated conversation with you about it. So read that literature, read the other literature related to it. That's one thing that I see sometimes that makes me wonder, why did this person put that on their application if they didn't want to talk about it with me, kind of thing. And it's just being genuine and showing who you are and being comfortable with who you are. Some people are quieter, some people are more extroverted. Really hard for the quiet people, I think, on Zoom, and I think they feel more worried about it, but there's nothing wrong with being quiet. And if you be yourself and you feel and I can see that you're comfortable with that I think is a better sign to me than someone who's really trying to be extra overt when that's not what their comfort is. But the flip to that is what Dr. Peter said, you should you are on the whole time, and it's a long day. It's, 6 or 8 hours of either Zoom or talking about yourself or something like that. So.
And so I know, Dr. Tannan, you said that you get hundreds of applications, but only interview about 36 of them. What goes into that selection process, and who gets that interview spot?
So it's complicated. I have a whole committee that helps me look. So I look at like a ton of the applications myself, and then I have a committee that helps me look through a lot of the rest of them. We have like a kind of a holistic rubric that we try to use, and then we will narrow it down. We do give preference, obviously, to all our home medical students, and then actually people who rotate with us. We probably give a little bit more preference to also. And then that takes care of like a decent number of application spots. And then we look at it's honestly, there's so many good candidates that it ends up being things that people saw that stuck out to them when they were reading the application. And there is a little bit of geography, like I mentioned, involved. Like definitely programs will interview a higher proportion of people, kind of, and like programs like ours that are a little smaller. Different other types of programs might be different, but we interview a lot of people from the Midwest, and then we do interview people from the East and West Coast and other places too. But I usually try to see that like they did some rotations in Chicago, or there's some sort of something about Chicago that would make them move here, kind of thing. Because again, it comes down to like, how do you differentiate between a lot of great candidates to figure out who's going to be right for your program?
Can I add one quick thing that I forgot to say, is just that also if, and again, Dr. Tannan, correct me if I'm wrong, but if you're interested in a program and they don't initially send you that interview invitation, it doesn't hurt to shoot an email and just say, hey, I'm interested in this program. Maybe they wrote you off because you live on the West Coast or something like that, and we're over on the East Coast. It really doesn't hurt. I know one of my co-residents didn't initially get that interview invite, and then sent the email of, hey, I'm really interested in this. They sent her an interview, or sent them an interview, and then they matched. And it really, I don't think it hurts anything.
So yes, I agree with that. That's actually how I got my interview at Rush, and look at me now. But I'll say two things that unfortunately changed that a little bit is the virtual interviews. So I start getting emails, honestly, from now until the interviews get released on October 17th, that like, I'm interested in your program. I really want to be in Chicago. And I'll get like literally hundreds of those. And then I actually do get some interview or some emails from mentors. So like, I worked with so-and-so, I think they're really great. They want to be in Chicago, or they want to, they're interested in your program. So I'll say use it judiciously. And I do think if there's something you're really interested in, yes, either you or one of your mentors can advocate for it. Don't send 5 emails to me, like every week, checking in if I've read your application and if you got an interview. But do it for the ones you really are interested in. Like, don't do it for all 50, because it just muddles the water a little bit. We didn't talk about it, but there's a lot of discussion, and I hope it will happen next year, to do preference signaling, which is actually being done with the ERIS applications right now. And I wish it was being done for us too. But that might help a little bit to help you show your preference for certain types of programs, because you'll have like a signal to send to us. So it is. The last thing I'll say is, back in the day in in-person interviews, we used to get a fair number of cancellations, because as people got other interviews, they would have to cancel one, like Dr. Peters said. And on the virtual platform, there's a lot less cancellations, honestly, because there's fewer conflicts, even though they are doing them on the same day. Like you mentioned, there are some situations like that. There's just not as much of the travel conflict, which was a big thing that weeded people out. And so you actually knew that, okay, this person chose to try a different program instead of ours, and that's okay, because that one is the one that seems to be a better fit for them. But then I have another spot that I can offer to someone else who did email me and say, you know what, I haven't gotten an interview, I'm really interested. And that happens less often now because there are less cancellations.
Do you think that interviews will remain virtual?
This is another soapbox of mine. You're only getting one PD's opinion. So I thought that most PDs would not want to continue virtual because of a lot of the things. Like, I think it does a disservice to people who are a little quieter and you don't see body language and stuff. They actually did, they polled applicants and PDs, and actually more than 50% said to keep it virtual, which I was completely floored by. I did not expect that to be the situation, but because applicants also said that, that's why they're staying virtual for now. I know there is definitely a monetary reason, and it is expensive to interview for sure. But I don't know. It's hard to say because you're going to spend 4 years of your life at that place, and I think like that's a long time to spend in a very like, you know, hardworking environment. You're going to be there 60 to 80 hours a week or whatever, working with people. And if you're not really there to get the feel of the place, it's not that hard for us as program directors and as faculty. We've been doing this for a while. We kind of know what to look for. I think it's harder for you guys, honestly, to gauge programs. This is your first time, you know, applying for a medical job, basically, and it's a kind of important one. So I do think it'll stay virtual for a while because of the polling data, I guess.
I'll say I remember my year I spent in total, I think between $8,000 and $10,000 on interviews, and that was sleeping on couches as much as I could. That was, you know, sharing as much as I could and everything. It is expensive, but you do learn a lot. And I know now programs are doing the second look, where programs already submitted their rank list, but applicants haven't yet. And so definitely take advantage of that.
Yeah, there's a virtual open, or there's an open house window. So we have to submit our rank list like the first week of January, and then there's like a 2-week or 2.5-week window that we can host open houses for people to come. And so that is nice for you guys to be able to at least come and take a look before you have to submit your rank lists.
And that brings me to my next question. So I have one more question after this, and I'll open the floor to the audience to ask their own questions. But we'll start with you, Dr. Peters. What went into your decision when it came to ranking programs for you?
I think really for me, it was a lot about fit. And those are the kind of things that you need to be thinking about even before you go on the interview, just to kind of make note of what's the best way that I learned. Some programs are, you know, very much kind of not, for lack of a better word, like handholdy, and some are more like kind of push you into the water, feed you to the sharks, you know, and then everything in between. And most places will be in between, but it's good to at least be kind of thinking about how much autonomy do residents have, how quickly are they seeing patients on their own, is there always an attending available for you if you have questions, or who's staffing their cataracts and things like that. Like what does the learning process look like? And then just looking at the people too. Are these people that I want to spend 4 years of my life with, that spend, you know, it almost feels like a marriage or something, because you're spending so much time in the hospital, you're working with them, you're working together, you're switching call shifts with them, you know, you really form a bond with your co-residents. And so meeting the people that will be your future seniors and making sure that you get along with them and that you can see yourself with them, I think is really important. And so I think, and then of course, location, will you be happy if you have a spouse or you have kids? Will your family be happy there? You will definitely not be happy at a program if your spouse is not happy. And so keeping that in mind too. You know, if you're single, what is the kind of dating scene life like, if that's something that's important to you? You know, some people don't want to live in Sioux Falls, South Dakota. I'm married, so I don't care about it, but some people don't want to live in Sioux Falls, South Dakota if they're single and, you know, and young and that kind of thing. So thinking about all of those things and what's most important to you. And then obviously the little things like, or not, I say little, but other things to think about, you know, what are the surgical numbers or things like that. I think ultimately you'll be a good ophthalmologist no matter what the surgical numbers are, but other things that you can kind of think of like that.
And then Dr. Tannan, what goes into your process of ranking students?
Again, that, like, I'll tell you, we generally like a lot of the students that we interview, and that's a good problem to have. So it comes down to the rubric that we have, which is somewhat of a hopefully holistic review. The interview has a pretty high weight too. And then we will use those two things together and come up with the rank list. And it's kind of scientific and kind of a feel thing. Like, you know, do we think that this person is going to function well? Dr. Peter says our program is like super autonomous. We have a basically 100% resident continuity clinic. And so they're not in attending clinics very much at all. And that's different from other types of programs. So like, will they function well in our program is a big part of the question.
And then my last question is for you, Dr. Tannan. So obviously ophthalmology is very competitive, and some students may consider dual applying or taking a research year. Do you recommend, or what about a student would you recommend for them to actually do a research year or dual apply?
So I think, again, you guys are in the like exploratory window where a lot is changing, like virtual pass fail, where I think this answer might evolve, but I think dual applying is important if for you as a family or for you personally, it would not be in your best interest to take another year if you didn't match. So ultimately, if for you and your family, it would be better to start working and become a resident regardless, then you should dual apply, because the match, I think it was 75% last year for US grad. So one in four is not going to match. And that can be a little bit tough then to find a good research opportunity or a 1-year opportunity. The other thing is, back in the day, people would be like, oh, just go do an internship, and then you could always apply or see if a spot opens up later on. But now that if my understanding is correct, which I think it is, now that the requirement is actually to do 3 months of ophtho in your internship, if you do a regular like medicine or like a transitional year, you won't have gotten 3 months of ophtho probably, which means you might have to do 3 months of ophtho at the end or redo your intern year. So it's not really that advantageous, I think, to just do an intern year now or like a transitional year if you don't match. So you're either then scrambling into a spot for something else with not much control, right? Because you're scrambling, you haven't applied dual, or you're taking a year off to do research, and you may not be able to do it based on income or, you know, your situation, your personal situation. To take a gap year and do research, I think there's a couple times I will suggest that to people. So one is if they, so I think, again, it gets a little bit harder now to decide on ophtho later in your career because we don't have numbers. So we use a lot of like, did you do some research or did you do some outreach or did you do something that shows you're interested in ophtho? That's not like an end all be all, but if you decide really late that this is what you want and you don't have a ton of exposure to ophthalmology, I think it'd be good to take a year off before you apply and do some research. If you think you want to be a clinician scientist or in an academic center and you really enjoy doing research, it might be beneficial to take a year off and do research and gain the connections that you have from there. I would say if you end up with a step 2 score that you're really concerned about, where you feel like it's below the average or not where you feel like you can be competitive, that might be a time to take a year off and do research.
Thank you for that. So we have about less than 15 minutes left, and so I'm going to open the floor for questions. If you'd like to ask a question, you can put it in the chat and I can read it out, or you can go ahead and come off mute and ask a question yourself. And you can direct message me or just put it in the general chat. So the first question I see is, how do you address red flags on your application?
I think you should just be upfront about them. Write about them in your personal statement, or somewhere in one of there's a personal statement and now there's 3 additional supplementary questions, or you have to pick 2 out of the 3. But address it head on. What is the red flag and what were the things that you did? How did you grow because of it? Things like that. And then it's up to the program to decide if they think that that satisfactorily addresses the issue, and if they see that you took ownership and grew from it, and that's what's important.
Okay, and another question I have is, do you recommend send the email you guys were talking about earlier about sending it to programs? Would you recommend sending that before or after invites have been sent out?
It's also complicated. I don't send all my invites out the first day. I send a certain portion out and then I wait. And for somewhat for this reason, because we don't have cancellations as much. So I kind of, once I see who accepted early on, then I'll decide. Like, part of it is also we want to get a diverse population. So if I send, I want to make sure I have like a fair number of men and women and people of different ethnic backgrounds and have a diverse pool that I'm interviewing. So I kind of do it in a stepwise approach. I think a lot of programs are like that, but I know there are some programs where they send everything out the first day and it fills up and then they go from there. So in the past, I would have said, wait until because back in the day, there was some student doctor thing and like everyone would post when like a certain program started sending interview invites out, and then people would start responding after they saw that some of the invites had gone out, then they would send their messages. But I think that happens less nowadays because there's like a specific date where you can start sending invites out and most people will send them out that day. So send it out earlier than that and be deliberate how you do it. And again, every PD is going to tell you something different. Like some PDs are like, I don't want them sent to me, send them to my coordinator. My coordinator kind of fills me in on them and goes through them and keeps track of them for me. Some people don't mind. And I have like a folder and I organize them with my coordinator too. But that's a very personal thing because that's kind of exploded since COVID. Like I never got this many emails before COVID. So, but I get a lot.
And then another question, what are some tips you have on networking at national conferences?
I can at least say a little bit about this one. And Temi can talk about it too, because she and I met at AAO, and so she can give you advice. So there's lots of like young ophthalmology meetings. So at ASCRS, the ASCRS, for anterior segment, there's like the YES committee, the Young Eye Surgeons Committee. At AAO, there's the Young Ophthalmologist. So definitely go to those. Those are lots of fun. You get to meet people not only at your stage, but you can help people that are, younger than you. You can learn from people that are older than you or that are currently residents or currently fellows. And I think for me, I tended to gravitate more towards like meeting residents and meeting fellows, and then they would kind of help, once you get to know them, they can help introduce you to the people that they know, or even, I guess this is kind of going back to a ways too. If you know residents, and when you're on an OA, you can ask them like, hey, which attending should I work with? Like, who likes working with medical students, or who has, a good reputation for working with medical students. And like some of them will even send the program director an email or a message that says, hey, I really liked this person that I worked with on this OA. So anyway, that's kind of going off on a tangent, but I think just kind of put yourself out there, be personable and don't be weird. And if you're getting weird vibes, then don't bother somebody. Or if they're in the middle of talking with someone else that seems like an important conversation, don't bother somebody. Don't be annoying. But definitely go to those kind of like those young ophthalmology meetings and just I think talk with people. I think, like I said, I focus mostly on residents. And maybe if there was a program I was really interested in, then I would be bold and go up to the program director, and just to at least say that I was interested. But I think otherwise that's what I did.
So I have a lot of questions in this chat box. So if anybody wants to come off mute and ask your questions so I'm not stepping on any toes, just raise your hand and I'll give you the floor. But if you don't, I will continue asking the questions. So, Alyssa, you have the floor.
Great. Hi, guys. My name is Alyssa. I'm an MS4 from SUNY Downstate College of Medicine, and I'll be applying this cycle. I just sent my application, so it's kind of nerve-wracking. But I just wanted to know, what ways do you recommend getting to know a program if we, for example, didn't do an away rotation at their program? But especially before the interview, because I would like to know a little bit about the program so I'm prepared to ask like really specific questions. So are there any ways you might recommend us get to know the program on a deeper level? I know at least one way is to contact residents, but I didn't know if there were any other recommendations.
So I think you could ask to like email the coordinator and be like, could I like sit in on grand rounds if they're virtual or things like that? That gives you a little bit of a feel of the program. The websites, everyone did a pretty decent job of beefing up their websites because of COVID and virtual things. So that's helpful. There are virtual open houses that people will put on. I'll honestly tell you that I stopped doing them the last couple of years just because like there's so many Zoom meetings and I had a hard time, doing all of them. But there are programs who do have that. That and then you can definitely like ask for, so there are some programs that have virtual aways too. So you at least get to like do a little bit, interact with some of the attendings there. And those are nice too. We definitely have people, we have, I think, our grand rounds link on our website, and it says, if you're interested in attending grand rounds, please email our coordinator. So I found that, and like I said, going back to the 60 programs, like there's probably 10 or 15 that you're really interested in. And then the rest are, that are also important, but spend your time on those 10 or 15. Like there's no way you guys have time to like try to learn about 60 programs. So be deliberate in the ones you try to learn about. Start with the ones that you're most interested in and you think actually you have the best chance for based on your application, like mid-tier programs or high-tier programs or wherever you are. And then you can also, I think reaching out to residents is great too, especially if you somehow know them, like they went to Vanderbilt and you went to Vanderbilt for undergrad, and you can be like, oh, I saw you went to Vanderbilt, something that gives you a little personal connection. Then that just warms it up a little bit for them to kind of start talking to you. Do you have other thoughts, Dr. Peters?
No, I think you answered it perfectly. Yeah. And I would say overall, for the most part, residents, at least in my experience, are more than happy to talk to you, and they'll tell you the truth about the program too. So I really relied heavily on residents when I was doing that sort of thing.
Thank you so much.
And Thrudy?
Yes. Hi, everyone. Thank you so much for having this session today. My name is Shruti. I'm also applying this year, like Alyssa, which is super exciting. I'm coming from the University of Texas, just outside of Houston. So my question has to do with what you were saying earlier about the correspondence that you get. I can't imagine what your inbox looks like right now, honestly. So after interviews, what do you prefer in terms of like thank you and follow-up messages? Because I hear things about like personal handwritten thank you notes and then it takes forever to mail, or sending an email isn't even worth it because like you have such a busy inbox. So what do you recommend?
What did you do, Catherine?
I'm trying to think. I think I sent thank yous to the people that I really did feel like I had a good interaction with. And if I could say something in the email that, I really enjoyed hearing about your experience at blah, 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 or I really enjoyed talking about blah, 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 then it was always better. I don't think that I just did like a blanket email to everyone, but I'm sure that there are some people that do. Yeah. What do you like, Dr. Tannan?
So I'll say I don't think a thank you note goes into the decision making at all, really. It's nice to get, and so I think whatever you prefer, like I hand wrote them however long ago, and I get mostly emails now. It won't change how I feel about you. So if you want to send a quick note via email, that's fine. Like we often get them right after the interview, which is nice, and that's. But yeah, make it personal and not like a cookie cutter type thing.
Okay, thanks. That's helpful to know where you're from.
If you want to send a handwritten, I mean, I don't mind. I like reading them. I'm not going to use them to decide where to put you on my rank list, basically. And I don't know if other programs do, but it's nice to get, but we're going to make our decision based on the things that we've looked at in your application and the interview process, basically. And
Yeah.
I hope I didn't like burst a big bubble.
No, this was really helpful, honestly. Thank you so much.
And then I had somebody ask if you could please restate what an effective and memorable personal statement would include.
I mean, I just think being authentic, it's so hard. I don't know, because we read hundreds of them and, they all say that you want to be an ophthalmologist and that you've done a lot of great things and you work really hard, which all of you do. So I think just being reflective of who you are, what you're passionate about, and what your goals are, and why you want to be successful, like what will make you successful in being a good resident, I guess, if you agree, Catherine.
Yeah, I think you're right. I mean, I've read a lot of personal statements now for fellowship, and I read a few for residency, but I think honestly the real advice that I was given was a lot of the personal statements are pretty much the same, and if you just don't be bad is a lot of that. And again, I'm sure that there are people that really write, like they're amazing writers and they write amazing personal statements and they can really make you stand out. But if you're not a writer, which I was not a writer, the best advice I was given was just don't be actively bad or actively weird or anything like that, because as long as you're just kind of staying in the middle, then I think that was the advice that I was given. Again, if you're not a writer. If you're a writer, then go for it. But
And another question I got was, how do you determine where to apply for OAs? Is it based on interest or your places of having a higher chance of matching?
Yeah, so I think definitely, so there's 2 or 3 things I tell students about this. So number 1, if there are programs that you are really interested in, doing an OA can be super helpful. And Dr. Peters mentioned she matched at the place. Actually, all three of our residents who matched last year ended up being people who had done OAs. They weren't, and it's not like we ranked everyone at the top who had done OAs, but I think you do get, in this day and age, you get a better feel for the program. It is a month-long interview, so put your best foot forward. Because now you're really under the microscope in terms of your interactions with people, how quickly you're picking things up, that kind of stuff. And no one is like scrutinizing everything you say, but just remember that, like, put your best foot forward. So number 1 is if you're really interested in a program for a variety of reasons. Number 2 is if your location geographically, you want it to be different than where you are in medical school. So if you're in Chicago for medical school, but you are from the West Coast or the East Coast, if you go doing away out there, that helps, because that shows up on your application and that kind of reflects the fact that you're interested in a different geographic location. And then definitely if you don't have a home ophthalmology program, I'll say I used to think it was a red flag if you do too many aways, because, and this could be flawed thinking, but, at that point I'm like, well, if they don't have the relationships with the people at their home program, then is that why they're doing so many aways? So I think 2, 3 max, but 1 to 2 is plenty, and then 1 at your home program if you have one. Now, if you don't have a home program, then I definitely think 2 aways is good, and maybe 3 because you don't have those relationships possibly. And so that's how I would pick it, based on like what's in that top 10 of like the programs you would absolutely love to be at, if you can get an away at one of those, and then if you want to demonstrate a geographic preference.
All right, this is just a little announcement. I'm doing a last call for questions. I don't want to hold Dr. Peters and Dr. Tannan hostage, so just go ahead.
I will say, Allison had one that I think got lost in the messages, just asking about the optimal balance, about research, step 2, clerkship grades, pass fail, and step, kind of how you would prioritize and balance if you were to put on a scale of importance.
So each program is going to weigh these differently based on what is important to their program. Like, we're not a super research heavy program. We're a much more clinical program. So we probably don't weigh research as much as a different program where they do have a lot of research, and they and residents are involved in research quite a bit. So that's a kind of hard question to answer because it's very specific to what the program is looking for and what they've set up and developed in their holistic review of like what they're looking for and what's important. It's kind of a crapshoot in terms. So I think research wise, what we care about is that you can execute a project like from inception to completion, right? So I don't care if you've done 10 projects, but I think it's nice if you've done a project and you did the IRB and then you presented it at a meeting and then you wrote up a manuscript. And that manuscript may or may not be published, in my opinion. In other people's opinion, it probably needs to be published to show completion, and different programs are going to have different thoughts on that. And that's more important to me, that you took ownership of the idea and helped execute it and bring it to fruition, basically. And then grades, clerkship grades are also kind of all over the place. Like some schools are completely pass fail. Some schools give 70% of the students honors. Some schools give 25% of the students honors. So you're not comparing apples to apples at all. It's complicated. So like I will look at grades, but then I will try to look at the dean's letter, or your whatever MSPE, to kind of look at some of the comments and some of the things that they say on there. Dean's letter doesn't come out till October 1. So that, the whole timeline, this is my other soapbox about the timeline, which I'm getting back on, but the timeline is complicated and you don't have all the information when you're reviewing applications initially. And so people have different ways of doing it. Like we narrow it down, and then once the dean's letters come out, I review their dean's letters, and people probably do something similar, I would assume.
And Dr. Tannan, do you have many DO applicants that receive interviews? And if so, are they looked at differently than MD applicants?
Personally, we have not interviewed as many DO applicants in the past, but I know that we are trying to be better about that, especially with trying to get a good diverse mix of people that we interview. So that's something in the last year or two we're starting to look at more, and so that's evolving because we're not as familiar with some of the metrics in the DO programs. But we had a couple. For me personally, as a smaller program, we had a couple DO students rotate with us this year, which was kind of my first step. And then we're going to look at their applications in a different way and kind of figure out how to involve a certain amount of people, hopefully from a DO background, also in our interviews. And again, this is program specific. Some programs will maybe have a specific number or a percentage they try to interview from different backgrounds, and that will be how they decide.
And then if your school uses GPA, are there any cutoffs that you look at specifically? And then if there are, if a student doesn't have a competitive GPA, what do you recommend to applicants who are very involved and interested in ophthalmology?
I don't have any cutoffs personally. That's probably what makes my life harder. But I think the point of holistic review is to look at things holistically. So you should be looking at almost all parts of it. But that makes life a little more difficult. So what was the second part of the question? So there might be people who have GPA cutoffs, but again, I think it's hard because every school is different and some schools have no GPA. So I don't know how you can have a GPA cutoff. What was the second part of the question? I'm so sorry.
No problem. They asked, what can you do to make yourself a competitive applicant?
So I would say if you are worried about your grades, like step score, GPA, clerkship grades, that is when it's important to have made a really good relationship with the mentor who's going to advocate for you. So you need to show your work product to somebody in your school or a research mentor or someone who can be like, yeah, I know this person maybe didn't do as well on clerkships because of XYZ, but I've worked personally with this person. They've done this, XYZ, this project, they did an amazing job on it. And I promise you, they're going to do a good job at your residency, even though, it might not be reflected in their clerkship grades. And we all know there's a certain amount of subjectivity in clerkship grades too. So you're never comparing apples to apples. You're comparing grapes to oranges to, different things.
And then somebody else asked, how are mid-tier versus high-tier programs determined?
Do you want to answer that, Catherine? What would you say is the thought?
Oh, I don't know. I don't put that much stock in the Doximity rankings or the US
Newswork. Yeah.
I don't really put too much stock in that. I don't think that somebody from a top whatever program versus a mid whatever program is necessarily a better doctor in any capacity. So I honestly think it's kind of a load of crap a lot of the times. Like I think that the majority of the residency programs will produce a very excellent ophthalmologist. And it's a lot of residency is what you put into it. If you don't work hard, then no, you're not going to be a good doctor. But if you work hard, doesn't matter what residency you go to, you'll be a good doctor.
I agree with that. So the official answer is there are, ratings like Doximity, US World or News and World Report. They're based on voting, like popularity to some extent, and outcomes to a very minimal extent. And then it's reputation based, like Ivy League or whatever you want to think of. So you can talk to your mentors at your programs, and they may have an idea of what they think are like top tier versus mid tier. And that might help you decide. But I think it really has to do to, like, again, these cutoffs mattered more because back in the day, people used to say, well, at that place, they only look at you if you have a certain step score and you have this and that. And as people are trying to do more holistic review, my hope would be that that's not as common. So then it also makes it a little complicated to tell you guys like where you should apply. But I think your mentors at your school, like either your deans or your program directors or your medical school educators, should be the people who can kind of help guide you into telling you like what types of programs they think you'll be more successful in applying to.
And I have two more questions. So on the topic of talking about goals and personal statements, is it okay to talk about long-term goals of serving the international community? For example, thinking about going back to your home country to serve as an ophthalmologist. Is that something that's considered as a red flag?
No. I think that's great. If that goes back to passion, like I want to know what you're passionate about. And if you're passionate about that, then you should definitely write about it.
And then last question, if my school doesn't have an ophthalmology sub-I, is a medical or a surgical sub-I more beneficial?
I don't know if Dr. Tannan, if you care from the application. Yeah, I kind of figured. I would say from the resident side, neither one is especially like better than the other. I would say if you're going to do it before your application goes out and your grade is going to be on the application, then do whichever one you think you'll have a better like shot at succeeding and excelling at. If it's going out after and it really doesn't matter, then I would just personal preference. What are you more interested in? I think the surgical skills that you learn on a sub-I of like suturing and things like that, not like it's somewhat applicable to ophthalmology, but really not even that much. And you'll learn all of that during your residency too. So if I would say if you're interested in more of one than the other, then pick that one. I don't think you can go wrong, honestly, was what I'm trying to say. Neither of them are that helpful, honestly. So
yeah, I'd say pick the one that you think you're going to be most successful in, especially if it's going to be on your transcript, and then the one you're more interested in.
I would say if you're doing it, most programs are doing a medicine prelim year. I think only a few have the surgery prelim year, so probably medicine. If I were doing it again, I'd probably pick medicine.
Alrighty, so that brings us to the end of the meeting. I want to thank everyone for joining, tuning in, acting, and answering questions. And a big special thank you to Dr. Peters and Dr. Tannan for coming through for me last minute. Thank you so much. You guys provided so much insight. I'm not even applying now, but I'm definitely taking notes on everything you all said. And I also want to say good luck to everybody who is applying or have already applied, and enjoy the rest of your night. Thank you.
Best of luck, everyone.
Thank you so much. Bye.